بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. Good morning everyone, to my doctors and my colleagues. Today I'm going to talk about medical emergencies and management during dental visits, supervised by respected Dr. Wasim Radwan. These are my key articles. Why did I choose this topic? Medical emergencies can occur in the dental practice at any time without any premises, whether the patients have received the treatment or not. These are my outlines, starting from introduction to medical, through the general dental councils, risk management, medical emergencies, and the equipment and drugs, and the training for the medical emergencies, and then with take-home messages. As an introduction, members of the dental team have a duty of care to ensure they provide an effective and safe services to their patients. That is, satisfactory performance in medical emergency in the dental practice has a wide-ranging implications in terms of equipment, training, standard of care, and clinical governance, and risk management and clinical audit. The revised and updated medical emergencies in the dental practice is designed to assist the dental team in safely and effectively managing medical emergencies. Moving toward the General Dental Council and medical emergencies, it is the GDC states that there is essential that all registrants must be trained in dealing with medical emergencies, including resequation, and possess up-to-date evidence of capability. Members of the dental team must maintain their knowledge and competence to effectively and safely deal with a medical emergency. Planning ahead, there should be at least 2 people available within the working environment to deal with medical emergencies when treatment is scheduled to take place. In exceptional circumstances, the second person could be a receptionist or a person accompanying the patient. The incidence of medical emergencies that have been occurred in dental practice includes vasovagal syncope, angina, hypoglycemia, epileptic seizures, choking, asthma, anaphylaxis, and cardiac arrest. It is estimated that on average, a general dental practitioner will experience a medical emergency at least once every 2 years. And as Prof. Al-Punni said, et al. In 2020, most commonly encountered medical emergencies in dental clinic may include allergic reaction, syncope, respiratory problem, cardiac arrest, epileptic seizures, and or diabetes-related complications. The risk management. Risk management can play an important role in reducing the risk of medical emergencies in the dental practice. It is therefore recommended that all primary care facilities have a process for medical risk assessment of their patients. Anticipation of potential medical emergencies that may arise should be highlighted by taking through a medical history, which is revised, updated, and checked each time the patient presents for treatment. It has been suggested that the presence of an updated medical history may help to minimize the risk of medical emergencies occurring. Now, the dental team ultimate goal is the prevention of life-threatening emergencies. Dentists initially should manage all medical emergencies in the same way by using what is known as the basic algorithm. It's the B60, which is the positioning of the patients, airway of the patients, breathing, circulation, and definitive treatment. Now, what is our medical emergencies that's covered in our topic, which is start as many guidance says: the adrenal crisis, anaphylaxis, asthma, cardiac emergencies, epileptic seizures, hypoglycemia, reflux sepsis, stroke, and syncope. We're gonna go through all of them one by one and how to manage them. So the important signs and symptoms to look out for to help correctly diagnose each emergency with the principle of safe and effective treatment where appropriate, the recommended doses of drugs. So, let's start with the adrenal crisis. What is the signs and symptoms? Collapse of the patients, pallor, cold and clammy skins, hypotension and dizziness, vomiting and diarrhea. So, how to manage it? Always start with airway, breathing, circulation, disability, exposure. Then call 997, state addiction crisis, and lie flat the patient and administration of oxygen 500 millimeter, and patient's hydrocortisone emergency intramuscular kit at the hand, which we're gonna give him intramuscular hydrocortisone 100 milligram. Moving toward the anaphylaxis, which is the allergic reaction to any material or anything that happens in contact with the patient inside the dental practice. What is the sign? It's sudden onset, urticaria, angioedema, flushing, pallor, respiratory distress, wheezing, hoarseness, and also anaphylaxis, likely sudden onset, rapid progression of symptoms, life-threatening skin and mucous and or mucosal changes. So what is the management of the patient with anaphylaxis? As always, A, B, C, D, E, which is the airway, breathing, circulation, disability, exposure, state, call for an emergency, state an anaphylaxis patient, lie flat, elevate the legs, if breathing not impaired, administration of oxygen 500 liters per minute, and administration of adrenaline 500 micrograms intramuscular. Repeat the adrenaline at 5-minute interval until an adequate response happens. For the pediatric doses of adrenaline, less than 6 years, we're going to give him 150 micrograms. Between 6 and 12 years old, 300 micrograms of adrenaline. Above 12 years old, as we said, we're going to give him 500 micrograms of adrenaline intramuscularly in the thigh. So moving toward the asthma. Asthmatic patients, the signs of symptoms of him, it's breathlessness, expiratory wheezing. When it's severe, it's inability to complete a sentence in one breath. Also, the respiratory rate more than 25 times per minute, and the pulse over 110 per minute. When it is a life-threatening cyanosis or respiratory rate less than 8 per minute, pulse less than 50 per minute, exhausting, confusion, decreased level of consciousness. It starts with the coughing, wheezing, trouble breathing, and also chest tightness. How to manage it? Airway, breathing, circulation, and also sit upright the patient. Follow the patient personalized asthmatic action, which is 2 puffs of bronchodilator inhalers, which is the solbitol. Repeat doses may be necessary. Early use of spacer divisor. Unsatisfactory or no response, or if severe or life-threatening, you should call for an emergency. While waiting for the ambulance, oxygen 500 liters, bronchodilator via the spacer giving 1 puff at a time, inhaled separately using tidial breathing according to the response, give another puff every 60 seconds, up to maximum 10 puffs. Moving toward the cardiac emergencies, signs and symptoms. Signs and symptoms may vary. Chest pain or discomfort that suddenly occur and doesn't go away. It may feel like pressure squeezing or heaviness in the chest. Pain that spread to the left arm or right arm or may to the neck. Feeling sick, sweaty, short of breathing. How to manage it? As we say, first thing to do is A, B, C, D, and also call for emergency, state a heart attack, comfortable position using sitting up the patient, give him 400 to 800 mcg, typically 1 to 2 activations sublingually. The GTN, which is dispensable aspirin 300 microgram to chew. Also, you should, through the resuscitation to the dental practice of the protocol, we should go it one by one. Moving toward the epileptic seizure, signs and symptoms, sudden collapse and loss of consciousness, rigidity, cyanosis, jerking movement of the lips, noisy breathing, tongue may be biting. What we should do with the patient with epileptic seizure? As we say, the ABCDE, safe environment, prevent the injury of the patient, do not put anything into the mouth, do not restrain anything. Administration of oxygen, note timing of the seizure. Once genital movement cesses, recovery position, if available, follow the patient's treatment. If it's okay, if no, call the emergency, and if necessary for the patient. The prolonged scissor, 5 minutes or more, or repeated rapidly, we should give him a midazolam. Oral mucosal solution can be given via the buccal route in the adult as a single dose of 10 microgram. Pediatric doses 1 to 4 years is 5 microgram, 5 to 10 years 7.5 microgram, 10 to 18 years at 10 microgram. Hypoglycemia, signs and symptoms: shaking, trembling, faster heart rate, extreme hunger, sweating, confusion, difficulty in concentrating, and dizziness. Hypoglycemia, we have two ways when the patient is conscious and unconscious. As always, we're going to start with the airway, breathing, circulation, disability exposure. Offer 15 to 20 grams of quick-acting carbohydrates, either glucotabs or tubes of glucogel when the patient is conscious. Impaired consciousness, we're going to call an ambulance. Recovery position, glucagon, 1 microgram intramuscular. Once consciousness return, offer an oral carbohydrates. If available, measure the blood sugar to help to confirm the correct diagnosis. For the pediatric doses of glucagon, less than 8 years of age, less than 25 kilogram, we're going to give him 0.5 intramuscularly. For the red flag sepsis, which is we presume there is an infection in the patients, if the patient looks unwell, is one of the red flag present when it is, which is the systolic less than 90, the heart rate over 130, respiratory rate over 25 per minute, not passed urine in the 18 hours, recent chemotherapy within the last 3 weeks. The management: airway, breathing, circulation, disability exposure. Refer to GDBC sepsis decision support tool for primary dental care over the air. Call for an ambulance, emergency, state a red flag sepsis situation, oxygen 500 liter, ensure paramedic pre-alert as a red flag sepsis. Moving toward when the patient's having a stroke, what is the stroke symptoms? Face dropping, arm weakness, speech difficulties, then it is a time to call an ambulance. For an emergency, as always, start with airway, breathing, circulation, disability exposure. Act fast and call for an emergency. Administration of oxygen, nil by mouth, appropriate position, it's one of the most important things. One of the most emergency situations comes in a dental clinic, which is the syncope. The patient feels faint, dizziness, pale, drinking, blurry vision, collapse, loss of consciousness, low blood pressure, sweating, and nausea and vomiting. How to manage it? Airway, breathing, circulation, disability exposure. Lie flat, elevate the legs, loosen tight clothes, and oxygen is not usually necessary. Once consciousness return, offer a glucose in a water or a sweet tea. Slow recovery, consider alternative diagnosis. Unresponsive, check the signs of life. This the emergencies drugs in the dental practice. Adrenaline, we give it for anaphylaxis. Bronchodilators for the asthmatic attacks. Glyceryl trinitrate spray for the angina and suspected heart attack. Dispersible aspirin for suspected heart attack. The glucose for the hypoglycemia. The glucagon for hypoglycemia also when the patient is unconscious. Midazolam for the prolonged convulsive seizures. Now for the emergency equipment in dental practice, pediatric, starting with oxygen cylinders, adult and pediatric embo bags for oxygen, pediatric and adult high concentration oxygen masks, the viral filters for embo bags, and the defibrillators, and also the emergency drugs kit. How to medical emergency drugs should be look like? It should be labeled, because the second person who's with you. It could be a receptionist or someone who's coming with the patients and he doesn't know what material, what medications to give you. When it's labeled, just you say for him, give me the medications that's under the label like asthma or anaphylaxis, and he will bring it to you as quick as he can. Training in the medical emergencies, all dental staff should be trained and should receive the regular updates on in the management of medical emergencies, running regular mock-up scenarios, drills themed around the medical emergencies. The team should carry out practice sessions throughout the year. And the take-home message, patients could collapse at any time, at any premises whether they have received the treatment or not. So we should be prepared, be aware, be ready. And thank you.